So let's talk about bone stimulation. We can think about helping people make better decisions in the third of the individuals who we know from basic survey data that use bone stimulators in their day-to-day practice. But at CoreView and at OrthoEvidence, our belief is that there may be 2 out of 3 surgeons, healthcare practitioners, physiotherapists, occupational therapists, and other groups who may in fact not understand the evidence for bone stimulation and quite frankly feel skeptical because they haven't really been aware of the quality of the evidence that's out there. We at CoreView see the opportunity as being the overall population of individuals, whether you're a user or whether you're not, to help you provide better information about where the evidence is and where ultimately bone stimulators fit into the day-to-day practice in the management of orthopedic patients. In the area of bone healing, there have been numerous innovations that have been aimed to accelerate healing and or delay or prevent the risk of a non-union. The focus has actually been to identify an adjunctive, systemically available, or non-invasive therapy to enhance fracture healing. One option is a bone stimulator, which is typically an externally applied, non-invasive, or minimally invasive product that is aimed to stimulate fracture healing and or healing of damaged tissues. The current players, one might argue, would be extracorporeal shockwave therapy, low-intensity pulsed ultrasound, otherwise known as LIPUS, or electrical stimulation. And within electrical stimulation, there are numerous other types of products, and I can tell you about those shortly. Extracorporeal shockwave therapies are fundamentally based upon the rationale that a high-speed sound causes a lithotripsy and ultimately was first used to crush kidney stones. It has subsequently been used in the treatment of pseudoarthrosis. Low-intensity pulsed ultrasound uses ultrasonic waves that are pulsed at low intensity that are also aimed to improve the fracture milieu to ultimately provide and enhance fracture healing through a cascade of biological systems that have been reasonably well described in the literature. Electrical stimulation in and of itself has 3 components, or 3 options. One is capacitive coupling, one is pulsed electromagnetic fields, and another is called combined magnetic fields. Capacitive coupling typically uses metal electrodes, which are applied to the skin and deliver the current. PEMF uses, or a PEMF device, uses an externally applied coil, which is used to deliver the current, which can be pulsed on and off. And finally, combined magnetic fields are devices with an external coil system. They use a direct and alternating current to produce both static and magnetic fields. And across all of these, we see a variety of evidence that has been focusing ultimately on their efficacy in bone healing across a variety of indications.